Well, let's get more insights onto this story as I have joining me the Cross River Commissioner for Health, Betta Edu. Thank you very much for your time with us on TV's News. So how far have you gone in locating other families that might be in dire need of help due to the fallout of this pandemic?
Thank you for looking into this. Really, a lot of families are going through very, very hard times right now. We set up the Nutrition Rescue Task Team, and their work is to identify these families that are really, really, really amongst the poorest of people in community and see how governments can intervene. First, from the health aspect, initially we had picked up 5 children, but we've got, I think, 6 more right now under care. And beyond this, we lost 2 within the last 2 weeks. So we went to one of the communities called Akansoko, and after working for over 30 minutes to get to the house of this particular child. We were told that the child passed on the previous night. It was really very painful for me, not because I had trekked for 30 minutes, but the fact that one more child was gone. These are really, really very tough times, the aftermath of COVID-19. And so as the country, as a people, even as public health practitioners, as we take our decision on whether we should have lockdown or not, whether we should restrict movement or not, whether we should take whatever decision it is that we want to, we must consider those who live every day on less than $1. Consider the fact that as soon as you shut down, as soon as you close the borders, as soon as you ask them to remain at home, their families, their children begin to go into this very high exposure to malnutrition, and then it leads to death.
Now, considering the nutrition crisis the state is grappling with right now, what strategies are you adopting to, well, lift some of these families that are rather facing this difficult situation?
Okay, so we're working, the governor of Cross River State created a humanitarian ministry, Ministry of Humanitarian Affairs, and then, of course, there's a Ministry for Social Welfare. So the Ministry of Health is working hand in hand with these other 2 ministries to see that we can give the complete holistic approach to this problem. So first and foremost, our duty from the health sector is to identify these persons in community, especially children. They are most important priority right now. Children in community that are malnourished, suffering from marasmic kwashiorkor, and some of them actually kwashiorkor. We've lost a lot of them already. We're trying to identify them and then, of course, take them to the hospital where they get treated. And then they would follow up with the primary healthcare workers at the primary level. But beyond that, we have connected with the Humanitarian Affairs Ministry, and we've also connected with the social welfare for them to help these families out of poverty line, provide some mini businesses for these people to do so that they can be able to fend for their families. Beyond that, the governor has created a lot of job opportunities. He just employed 20,000 persons into the local government civil service, and he's been creating a lot of jobs using the industries that are created in Cross River. This is to reduce the level of unemployment. This is to cushion the effects of COVID-19 on the state and indeed the economy of the nation.
And how sustainable are these projects that the government is, adopting to, well, lift the families out of the poverty, if I'll put it that language?
Oh, they're very sustainable. Of course, when when you have a civil service job, it's almost like for life until you're retiring from it. So there's that job security. And for the other companies and industries which were created by the government, the governor of Cross River State is working to see that they can privatize some of them. This would help as a sustainability plan to keep them as long as possible. But really, what is of most concern to us is creating a team and then networking between the secondary and the primary level of care, as well as other NGOs, CSOs, faith-based organizations that are working in the field to see that we identify these children, we pick them up on time before we lose them, and then we try our very best to see that we can really nurse them back to thrive. It's very terrible. Like the child which you see in the video which you have just played, that child is 2 years and 6 months. That child is under 4 kg. The child is less than 4 kg. This is the weight of some children that are still in utero and that they're still in the womb right? But you have a child at 2 years and 6 months, not even able to work, not able to do anything at all. These are the kind of children we're seeing. We're also happy that UNICEF has indicated interest to come in and work with the state government to see how we can mitigate against this in the community.
I really hope the best for the children and, of course, families affected due to the fallout of the pandemic. Commissioner for Health, Betta Edu, thank you very much for bringing your insights on this very issue.
You're welcome.